Well, hello everyone. My name is Alexandre Amaral. You're most welcome here for the first webinar of MILEN. Who is MILEN? MILEN is actually an expert network of media and information literacy. We consist of 13 people across the globe who have various expertises in the topic. And we feel that it's our responsibility to put forward some interesting debates or advice or thinking material for our audience in this relevant time. So we're hosting today what will be the first of a series of webinars on the topic regarding media information literacy and coronavirus. Today's webinar is specifically devoted to disinformation and who are the main actors regarding that. Are there politicians, religious leaders, citizens, and who is spreading disinformation and reliable information? So today I am joined by two of the most incredible experts I have ever met. Let me start introducing them here. The first of them is Naglaa Elemary. She's a former editor at the BBC, lecturer at the British University in Egypt and at the Jordan Media Institute in Amman. She's also a media trainer and consultant across the Middle East and North Africa, and has knowledge of media reforms in all the Arab countries, working closely with local institutions. How are you, Naglaa? Let's hear your voice.
Hello, Alex. Yes, I'm here. Hello, everyone.
Hello.
The second speaker we have today is Tamar Kintsurashvili. She's the executive director at the Media Development Foundation in Georgia. She's also an associate professor on media ethics and propaganda research methods. She runs the project, youth project Myth Detector Lab for Media Literacy in Georgia, and has recently joined the International Fact-Checking Network from Pointer. How are you, Tamar? Hope you're well.
Fine, I'm safe. Hope you are as well.
Perfect. So let's get this thing started. It's supposed to be more in a conversational style. So I want, if anyone has any questions, you're most welcome to jump in. I'll just ask if you can raise your hand on the Zoom and I'll unmute you when the time is right. But let's get it right into it. So I want to start with a very generic, broad question, but Naglaa, if you can introduce us a little bit, how is the infodemic in your side of the globe in the Arab world? You told me yesterday that for the first time, maybe people are actually trusting governments and authorities.
Yes, it's an amazing situation, and I think it's a unique situation in this part of the world. In most of the Arab world, most of the people, maybe they trust the governments and they trust the media run by the government. And this situation is unusual because usually due to the tight censorship and tight regulations over the media, people look for the information on alternative media, on social media. But this time with the coronavirus, we see very little of putting in doubt the information coming out of from the governments and from the local media. I had a conversation with Mark Gardner this morning, and he was telling me that there is 12 new cases in not very far from here. And when I asked him from where did you get the information, he said from the TV, which is the state-run TV. And he was talking about it as a credible source of information. So this, for this part of the world, is absolutely new, unique, maybe because the issue here is about health. It's an issue of life or death. And people are more or less trying to have solid information from the authorities for the first time, as I said.
That's super interesting and not something that you would expect easily. I can tell that's not the case at all here in Brazil, but we'll get to that. Tamar, why don't you go ahead and show us a bit of light into the situation in Georgia?
Actually, people trust in official information. There is no way not to trust because healthcare officials are officially in charge of our well-being. We have a little bit the complicated situation and diverse sources of disinformation. First of all, this is the information influence activities of Russia, who tries to blame in everything the Richard Lugar lab, which is a lab built by support of US government. And it's a high level of security lab, very useful in this situation for diagnosis of coronavirus, because it's unique one in our region. It provides a fast testing system and scientific research to understand the origin of the coronavirus itself. Besides this, we're observing the problem from Orthodox Church, who disobeys government and government fails to enforce emergency situation. On the eve of Easter, it's quite complicated in our society because healthcare officials are warning about dangers and turning our successful story into development like in Italy, because health system is not able, we have limited capacity to deal with large number of infected people, and the cemeteries are closed, but government fails to influence Orthodox Church. And besides the fact they are keeping distance, they are using the spoon multiple times for holy sacrifice. And this is very dangerous for our society. That's why it's very alarming situation right now. Besides this, there are of course false cure cases in media, like clickbait sites trying to gain some economic gain from this pandemics. And
so that's exactly what I wanted to ask you right there, because it's a very different situation from what we're mostly used to regarding disinformation. So I'm asking myself, and a lot of people are asking also the same question, who's behind all of that? What's the intent of spreading disinformation that could affect the health of millions of people and possibly lead to death? Is it the case of external propaganda, as you mentioned, the Lugar Lab? Or how do you deal with that, especially with so many delicate situations? When we talk about religion, you're stepping on eggs all the time. So how can we?
There are different interests, of course, political one, economic, sometimes poor journalism also is the cause of disinformation or misleading information, because journalists are not specialized in healthcare reporting. They don't know how to verify information. And this is the field we can work and help them with healthcare fact-checking, which is new for the global journalism and the journalism community in our society. It's everything together, but responsible approach. Journalists somehow cooperate with healthcare officials, and they try to verify information more carefully rather than before, but they are learning by doing, and this is challenge. But the yellow type of journalism and clickbait sites, they are trying just to attract readers with catchy headlines, and it's their own agenda and irresponsible behavior.
Yeah, if I can add something from this side of the world, here the religious actors have a completely different stand than what Tamar just said, because both of them, so I mean the church and Al-Azhar, which is the biggest institute for Islam, Sunni Islam, not only in Egypt, but in the entire Muslim world, both of them banned any gathering. So they are really playing a positive role in this crisis. However, the disinformation is coming mainly from the businessmen. And we had a very telling example. One of the biggest businessmen in the country, he put a tweet saying, okay, look at Sweden. Sweden, they don't have this lockdown. However, they are doing well. And it was amazing because the one who answered him, replied to him, was the Swedish embassy in Cairo. He said, okay, I think you got it wrong. This is not completely accurate. And they replied to him. So we have really the big businessmen who are trying to play down the impact of the coronavirus and the impact of the lockdown just to get people back to work. And this is the first one. And the second one is people themselves, but for different reasons. Usually we look at the disinformation when people start to get some messages viral on social media because of the fear. Here it's the opposite again. We have people copying and sharing misinformation or disinformation, seeking hope. So it is about treatments, it's about vaccines, it's about this doctor or that doctor who is doing some experiments there. And so it's a kind of trying to lift up a little bit the spirit of the people locked down. So it's, again, as I said, it's unique and very interesting to watch because it's not what usually we find when we work on disinformation and misinformation.
Perfect, Naglaa. And I have a question to get right back at you. I know for a fact, for example, here in Brazil, we see a lot of people trying to downplay the situation on economic interests, let's say. And one of them is our own president. What I think is very interesting to highlight is that for the first time, Twitter has deleted posts from world leaders. So both the Brazilian president, Jair Bolsonaro, and also the president from Venezuela, Nicolás Maduro, who were claiming that there were medicines or something that people could take. And this is actually the first time that Twitter and social platforms have been deleting content from world leaders. They usually say that they will err on the side of leaving the content up for public interest. So I want to ask you, how do you see this attitudes by social media platforms, which is something I've never seen before? Is it the right tactic to remove the content, or should we actually try to flag it in some way that we preserve it for historical?
Yeah, my own position would be, I think I would rather go for keeping such disinformation while explaining to people that it is not correct. Because I think we need to reach a point to take this responsible, whether they are the political leaders or the big businessmen, accountable. Because such disinformation has an agenda, an interest, a very, very narrow interest behind, but they are playing with the lives of people. And at a certain point of time, they should be accountable. So erasing them or deleting them, it's deleting the traces, in fact. And I would find myself, no, we need really to keep track of such manipulation, because this is a clear manipulation for very narrow interests and not for the interest of the biggest number of people.
I see also, I'm going to ask Tamar right now, because I know she's a part of the International Fact-Checking Network. I see a lot of people putting forward this notion of maybe international regulation or international cooperation on the media professional side. So why don't you go ahead, Tamar?
Actually, there are practices when Facebook cooperates with third party, but it covers certain countries, not all of us, including Georgia, when it allows you to identify and mark that this news is fake. It's best approach, I agree with Naglaa, but if you do not have such regulations or coverage or partnership with Facebook, certain content might be harmful, especially about false cure, because I agree it's related to hopes and people believe and want to find something helpful. But using the certain medicine might be damaging for them. If it's harmful content, it might be deleted for certain purposes. It's a very delicate issue. I have no clear answer, but I have some doubts about this issue, how it might be regulated, not to harm and inform and balance these two notions simultaneously. And I would like also add that not all religions in Georgia are disobeying law, because Muslim community and Catholic Church, they all actually, they are closing churches for people. They are observing religious ceremonies, but they are keeping distance, and they are more in line with state policy not to harm population. I'm talking only on about Orthodox Church, which is dominant one in Georgia.
Perfect. I just want to remind everyone who's participating that if you want to pose any questions for anyone or just share your own experience, please raise your hand and we'll get back to you. So why don't we continue now, Naglaa and Tamar, talking to our fellow media professionals and media literacy, information literacy people who are out there. How can we put forward the critical thinking on this difficult time? We're all online, we're all doing stuff from our homes. Is there any best practices that we can share to get people thinking?
Actually, we usually consult health professionals when we find something related to medication, or if it's anecdotal evidences and there are no proof, we rely mostly on credible scientific sources, and we advise journalists to follow these rules. We translated some guidelines from Poynter Institute, and following these regulations, we're thinking to include some blogs from doctors, because they are more credible communicators. Fact-checking does not work always. It's better to involve professionals, because people trust mostly, and we have really very trustful professionals dealing with coronavirus pandemic. Unfortunately, we have the minister who said today that she's not aware whether multiple use of spoon is source of infection, since there is no scientific evidence of this. So on the one hand, we have very good professionals. On another hand, there is a problem of political leadership in certain cases. But people really trust health professionals, and they are very trustful communicators, I would say. They are not only curing people, but also communicating with public in a very professional way.
Absolutely.
Yeah, I totally agree with Tamar. If I may say something quickly, what we see on social media going really viral, but we don't see it enough in the media, is this kind of accounts from the professionals and also from the people who got the virus, or someone in their families got the virus. So the real people talking, and it's maybe lacking in the media, and we try to push the professionals, the media professionals, to put more the accent on people and not only being just publishing the statements from the government. This is, I think this is very important because it's a first-hand information, plus the human side of the stories. Sometimes it's gloomy, but sometimes also it's giving us hope. So this will be a balance in itself, and it's very important to put it in place.
100%. Hania, I see that you have your hand up. I'm gonna unmute you so you can share your thoughts with us. So please go ahead. How do I? Trying to unmute. Yes.
You can hear me?
Yes, we can.
Okay, perfect. Actually, I really appreciate the analysis submitted by both Naglaa and Tamar. And in fact, I totally agree how much really coronavirus crisis created a transformation in how people perceive the role of their governments and formal media. In Palestine, for example, here suddenly all the people feel, yes, Big Brother is watching us, but also Big Brother cares about us. People are welcoming the restrictions. People really want even stronger restrictions. They want people who disobey regulations to be punished. So for the first time, there is actually a turnabout in how people view the role of leadership and government, and how they also, I totally agree with Naglaa, that suddenly people really respect and think that this is the correct source of information, which is the formal media. We have, for example, in Palestine, the spokesperson of the government who comes twice a day and give a briefing to the people. He became so popular in Palestine. It reminded us actually during the Gulf War when we had the Iraqi As-Sahaf who was all the time giving briefings. So now we call our own spokesperson, Ibrahim Milhem, the same as As-Sahaf. People are waiting for him. People love him. People cherish him. Everybody thinks that what he says is really like the truth. And in fact, I believe governments and official governmental media has learned a lesson, because it reflects kind of a transformation in how governments are representing themselves. At least I'm talking about Palestine and maybe Jordan, because we have now very frank speeches, information coming out from our officials. They are telling us about their capabilities, but also about their vulnerabilities. They are being very true about, even if they have some, misfailure in the testings, even they are true about the budgets they have, how much this can last, and so on. So this has really made a big change. And concerning actually religious authorities, for the first, we have a total kind of coordination between both Muslim and Christian faith and our authorities. For the first time, we have been hearing on the, there is the daily call at Muslim mosques for prayer. So usually they call people to come to the mosque to pray. So now they when they call, they say as-salatu fi buyutikum. So pray at your homes. So they are calling people not to come to the mosque. And the same with the churches. We had Catholic Easter just last Sunday, and everybody was just celebrating it from home, praying for home. I think in Israel they have a big problem with the Orthodox Jewish community. On a daily basis, we are witnessing disobeyment to the restrictions, and this is causing lots of problems, because both Palestinians and Israelis, they interact, and this really makes the things spread quickly. If you give me just another minute.
30 seconds, will that do?
Okay. It's actually a question, because concerning misinformation, like in Palestine, we have more of rumors and coming on people who might have caught the coronavirus and why and blah, blah, blah. But mostly we have lots of misinformation coming and being circulated on social media, whereby we have the source of the information is embedded in the text. So usually, like it would say, like 2 days ago, people were circulating a piece of news where it's quoting like a famous research institute or this or that university that they did the study, and the research came and it showed that really coronavirus doesn't live on surfaces. And this is why all the, using this alcohol to clean surfaces is useless. So this was spreading, and in fact, people don't know how to deal with it, because it's embedded that it's from a research institute. But of course, people will not take the step of going and double checking or whatever. So how do we deal with such kind of information being spread among the people? Thank you.
Please, Naglaa or Tamar. Feel free.
Yeah, I think what we see, there is a lot of, I don't want to say fake news, but at least some misinformation or disinformation going viral. People are trying to find an explanation. The virus is still unknown. There is a lot of question mark around it, and people are keen to understand what is happening. The source of this virus, what was it? So we see a lot about it. How it is transmitted, whether the hot weather will kill it or not, or this kind of question marks. People are trying to find a solution, an explanation. And for example, here in the region, we have very few cases, in fact. If we compare the cases, we have the numbers we have in the Arab region to Europe, which is just the other side of the Mediterranean. We have very, very few cases. And people are trying to find an explanation. Why is that? And it's funny because you can see in Egypt, for example, so many posts on Facebook or on Instagram saying, okay, this is because we are built like this. It's our immune system. And sometimes it's what we eat, especially in the breakfast and so on. So I think the source, again, it's not this information because there is an interest or there is a hidden agenda behind it. It's just because we don't know. And people are keen to find an explanation. They want to know what is it all about exactly. And unless we have a solid explanation coming from the scientifics, I think this kind of stories will continue to be shared and believed by people.
Actually, in our case, we have everything: misinformation, disinformation, as I mentioned, political agenda mixed with poor professionalism and reporting skills. Besides Facebook, there are newly created websites, and we recently published our investigation on the sources of this information. And we found several clones: CNN, BBC, ABC News, and their IP addresses were located in St. Petersburg. That's just indication their political intentions. But besides this, clickbait sites are emerging on a daily basis with headlines attracting people attention, but just providing the false cure content, type of content only.
Now, I think this is a perfect time. I'd like to actually jump in and ask some of our colleagues. So for example, Eddie, who's here beside me in Bolivia, what about those who don't have Wi-Fi, Eddie? We often talk so much about online disinformation, but there's a lot of word of mouth spreading around, especially in communities and so on.
Yeah, I mean, I think obviously I'm interested to see how the digital divide is affecting how people can access information. You know, here in Bolivia, we're on total lockdown. We're only able to leave one morning every week to buy groceries. No exercise outside, and everyone just kind of needs to be at home. And we see, you know, those campaigns online, you know, stay at home, listen to this concerts, you know, from opera singer in Italy, or, you know, live streaming, other things. And it kind of assumes that people have constant internet. I know here in Bolivia, they passed a law that they can't shut off internet as a public good, which is good. But I think many people on the outskirts of town or in the rural areas, they don't have Wi-Fi at home. They rely on mobile internet. And even with that, it's not like a fixed contract. It's basically prepaid credit where you load, you know, credit as you go. And even with that, you buy packages. And most often than not, there are social media packages where you may get WhatsApp free, you may get Facebook free, but all other sites are, you know, you need to use your megas for that, your data for that. And so it puts people at disadvantage to not be able to have other sources and be more vulnerable to what is happening on WhatsApp. And as we all have heard many times, it's misinformation or disinformation that people are spreading. And so it's almost concentrated in that way that they don't have an option to look for other sources. And so, I think that's something we need to consider. How do we reach those other people? It reminds me, I mean, following what's happening around the world, and I see, in the US, there's a well-respected expert, Dr. Fauci, who many people think is kind of the adult in the room. But I don't know if it's he or their department, but they made a conscious effort to go to where people are, and especially young people. And so he's appearing on Instagram Live with NBA professional basketball players because they know they have a huge following. He's been appearing on, talk shows where young people are. And so it's not wait for people to get news from the traditional trusted places like New York Times, Washington Post, but understanding that not everyone goes to those sites. So how do we get the message out and go to where people are and where people access information? So I think that's a really interesting case, and I'm sure Osama is seeing that in India, how people are, affected by the digital divide, and I know they're doing some really good work to helping people get online or access information.
Thank you very much for your input, Daddy. That was some great thinking right there. If someone else wants to jump in with some remarks, Osama, I know that you're working, as Eddie mentioned, on the digital divide. If someone else, Anna, you have your hand raised. Why don't you go ahead, please?
Yes, I just wanted to add that what we see with the group that we are working with, which is migrants and refugees, who don't necessarily always have the digital divide, but they do have a language barrier, which they don't understand Dutch. And so far what we see is that all the official sources that we're supposed to listen to for recommendations and measures we should take are in the Dutch language. So what happens is that they are very much relying on news, what is being spread through friends or family through WhatsApp. So they've been quite the victims of a lot of disinformation circling, that lemons cure corona, or that you need to more heat up your living room or your house, and that can kill the virus. So now what we see are some initiatives like how to overbridge this. There's been a bus driving around in, for example, in parks where people are gathering, where they say just the most simple thing, like the 1.5 meter of distance that should be kept, because people who didn't understand Dutch were actually gathering to pray sometimes in parks and not respecting one of these measures because they simply didn't know what it was. So they also started a telephone line as well for migrants in the Netherlands, where they can call and find out more information about what's going on surrounding the virus and measures that we're taking. Just wanted to share.
So, no, brilliant. I think it's very important, especially I'm going to ask everyone if we can share relevant links. So once we post this webinar online, people can actually go to the comment section and see if there's anything that can help them. I know that I'm working with the GAPMIL Youth Subcommittee, and we've been gathering reliable material to be transcribed in 9 different languages. So especially for those groups, it's very important to have some material tailored for their realities. I know that Hania has her hand up again, so please go ahead, Hania, and then if we can come back to Naglaa and Tamar for some final remarks, and then we can finish this on a positive note. Please, Hania, go ahead.
In fact, I think in our times, maybe with this coronavirus, I think the whole world has been flooded with info, with videos, with awareness raising in different languages, on different modes, whether it's social media, regular media, but still actually, as has been discussed, the information, the awareness doesn't reach everybody. And yes, it's true that sometimes it's because the internet doesn't cover all places or because of the language barrier, but also sometimes it's because of the culture. So in Palestine, you can be amazed of how the people are divided between those who are complying more than 100% with all the regulations, with all the information. And there are parts of the population who think they are somehow heroes. They are the untouchable, that they are somehow, they will be safe. They will never caught the coronavirus. And they you know, regardless of how much awareness raising and information available, still they think they are the machos who can defy and who will be all the time safe. So I think it's very interesting to really also check why people aren't really abiding, like as we said, because of the internet, because sometimes the places where people live, because sometimes some of the restrictions cannot really apply to a poor family living, all of the family, I don't know, 10 or 12 people living in a very small space, and then you ask for social isolation or someone to be put in a room alone. So this is why it's very important also, like, to see what else could be done to reach out to those people and to really, because it seems we will be kept with the coronavirus crisis for several months to come. So so we need also interventions to look beyond the current times and to look into the future as well. Thanks.
Thank you very much for your input, Hania. I think that's very well said. Tamar and Naglaa, if you have any final remarks, please, let's finish this webinar with a positive message, what we can do about the future.
Actually,
yeah, go ahead, Tamar.
go ahead.
Go ahead. I'm waiting. Yeah.
Okay, I think we should develop our effort. We should develop somehow healthcare fact-checking, because we are also learning in this process. We are dealing with anecdotal evidences on the daily basis, but it's crucial time for our organization we are having more contacts with scientists, health professionals, and it's our future priority to focus more on healthcare issues and to promote professional and responsible journalism in our society, which is very much needed, because we are dealing with the lives of people and information might be really harmful. So our new motto is a healthy media consumption. This is what we are doing, and we are trying to contribute with our efforts to overall situation. And just last remarks, only happy people in our society are far-right groups. They are happy that coronavirus stopped migration process, and they are interpreting this development like some punishment for our sins and the pervert lifestyle imposed from the West.
Okay, I don't know if I have a positive note or to finish with or not. Anyway, I think what Tamar just said is very important. Maybe we need to focus a little bit on fake news in the science side, because this kind of news we see, this research done by this institute, I don't know where, it's really very current in all media, and people don't stop and think twice before publishing it. So this is one. And the second one, yes, we saw that some, as we said, people are watching the media run by the state. The states, like Tanya said, in Palestine or Jordan and in other Arab countries, they changed their communication policies. So, and that's why they are really getting positive feedback and people trusting them during this crisis. Let's wait and see how they will do in other issues after coronavirus. So let's hope that it will be a transformation towards more transparency and more flow of information coming from the officials.
Perfect, thank you very much. I see that Osama has just raised his hand as we are about to finish. So Osama, you have 1 minute, please go ahead. You're muted, just a second, I'm gonna unmute you somehow.
Hi everyone, it was nice to listen everyone from all parts of the world. I thought it might be necessary to contribute some viewpoint from India. We are also part of the lockdown world, and we are largely affected because we have lots of migrant laborers and everybody roaming around, and people are going back and they are restricted. We also have a situation from the technology perspective is that about 500, 600 million people who are, mobile phone users, prepaid users, they are unable to use it because they can't pay for it because they all were prepaid users and they don't have money to pay. So there is a lockdown economic effect. There is a lockdown connectivity effect. There is a lockdown hunger effect. There is a lockdown access to food effect. Beside that, of course, we are absolutely on a negligible curve of the people who are affected by COVID. But perhaps it will take a little longer for us to come into the peak area, maybe by the end of June. But like Naglaa said, and many people said, that we are certainly living in a different world, which is teaching us a lot of lessons. Like you said, going to the positive note, I think we need to learn a lot from this COVID restrictions, from health perspective, from lifestyle perspective, from economic perspective, and that can we go into the need-based economy rather than a desire-based economy.
Perfect. Thank you very much. I think that's some great food for thought for us to end. For those who are watching us on our social media, good news for you is if everything goes well, next time this webinar is going to be held live, so you can participate and ask your questions to all these incredible MILEN people who are here. I know that I've learned a lot here today. Hopefully you did as well. We're ending this webinar. I'll see you. Stay safe. Bye.